Hello, I'm talking about diarrhea and vomiting today, which is also known as gastroenteritis. So, itis means inflammation, which is a swelling and redness of the gut. So, gastritis means inflammation of the stomach, and enteritis means inflammation of the intestine. And sometimes you can have just vomiting, sometimes you can have diarrhea, sometimes you can have both. Most of the time, 95 to 99% of the time, it's virus. So it's a viral infection. So basically, antibiotics are not going to help. It lasts usually up to a week. So it starts with vomiting and then may progress to diarrhea, or sometimes can be just vomiting. The treatment is supportive. That means there is no treatment as such. If the vomiting is becoming too much and the child is not able to keep any fluids down, they need to be taken to A&E, where they need a medication to stop the vomiting, and then we try what we call oral fluid challenge. The way to treat it at home or at hospital is by giving the fluids slowly. So first of all, the main thing is we try and give them solids and they keep vomiting. So do not attempt that. If they are vomiting, then stop. Just completely stop for half an hour. And after that, either you can use water or you can dilute a good quality apple juice 50-50 with water, or you can use ORS or Diarrhoea in the UK, and give 5 mils every 5 minutes. And that's, if you come to the A&E, that's exactly what we are going to do. We are going to give you a bottle with a syringe of 5 mils, and we advise you to give it 5 mils every 5 minutes. You can do it at home, and that stops the vomiting. Because if you give it too much in a go, then everything will come out. Same with diarrhea. If there's lots of diarrhea going on, what we want to do is prevent dehydration. And the signs of dehydration can be sunken eyes, very dry skin, very dry lips, no tears in the eyes, and reduced urine output. So what body does is, if there is not enough fluid coming in, body tries to retain the water and you pass less urine, but you should be passing some urine. If there's no urinary output, no urine for about 12 hours, then you need to take the child to A&E. Otherwise, you manage it at home. If the child is otherwise active, alert, feeding a little bit here and there, if it's a baby who's taking the breastfeed, but less, it's okay as long as they are passing urine. So the management again is fluid replacement with water, apple juice, or Diarrhoea slowly, 5 mils every 5 minutes. If they vomit, stop and start again after half an hour. If they keep vomiting, go to A&E or at least see a GP. There is no treatment. Antibiotics are definitely not indicated. Even if it's a bacterial gastroenteritis or diarrhea, we tend to avoid giving antibiotics because they can make the situation worse. So paracetamol, ibuprofen, and fluids.